Hello, today we're going to look at the Chapter 12 case studies, and we're going to start with the Tetrodotoxin Poisoning. So it talks about Sabir, a 22-year-old student traveling to China. He was rushed to the hospital after trying a new fish called puffer fish, and this fish contained the poison tetrodotoxin. So he had numbness in his mouth and all over his body. He was breathless. He had weak legs. He was diagnosed with poisoning, and he died 3 hours later from cardiac arrest. So this tetrodotoxin blocks fast voltage-gated sodium channels in nerves and cell membranes. So it's not blocking leak channels. It's blocking the voltage-gated sodium channels in nerves and cell membranes. So we start out by looking at some questions that you should already know. What is the resting membrane potential of a nerve? So the resting membrane potential of a nerve, if we remember here, like here's the neuron, and inside the cell we have negative 70 millivolts. Okay, what three factors are responsible for creating that resting membrane potential? Well, first of all, there are negatively charged proteins inside the cell. Second of all, there's the electrochemical gradient where sodium ultimately wants to move into the cell and potassium ultimately wants to move out of the cell. And the third factor is that there's more potassium channels, potassium leak channels, than sodium channels. So what this tells us is that there's more positive charges coming out than there are positive charges coming in. And so in comparison, there's going to be more positive charges outside the cell, making the inside of the cell more negative. That brings us to this negative 70 millivolts. So those are the three factors. What's an action potential? An action potential is when there's enough positive charges that enter into the neuron that the charge inside the cell hits negative 60, which is millivolts, which is threshold. And after that, the sodium-gated channels open up on the axon and sodium pours into the axon, making that charge go up to 30 millivolts, positive 30 millivolts, at which time the potassium channels open. And when the potassium channels open, then those positive potassium ions move out, bringing that charge back down to a negative 70 millivolts and eventually to a negative 90 millivolts. At the same time that those potassium channels opened at positive 30, the sodium channels then close at positive 30 millivolts. So the charge in the cell, in the axon, is going to go all the way down to a negative 90 millivolts. Then the leak channels and the sodium-potassium pump help to bring that back up to resting. So an action potential is an all or nothing depolarization of a nerve cell. It's all or nothing because if it hits a threshold, there is going to be depolarization of that nerve. And it's triggered if the stimulus causes a nerve to depolarize to that threshold, which is negative 60 millivolts. Depolarization means that the nerve cell becomes more positively charged inside compared to the outside. The next question is, how are fast voltage-gated sodium channels involved in the generation of an action potential? Well, we talked about how once threshold is reached, those voltage-gated sodium channels open up and sodium pours or floods into the axon, bringing in positive charges and raising the potential all the way up to a positive 30, anywhere from positive 20 to positive 30 millivolts. When sodium ions rush in, we call this rapid depolarization, and that is the active stage of the action potential. So the next question is, based on the information given to you about the action of tetrodotoxin, what would be the effect of tetrodotoxin on the generation of action potentials in Sabir's nerves? Now, we were told that tetrodotoxin blocks the fast voltage-gated sodium channels in the nerves and cell membranes. So if these are blocked and sodium cannot come in, this would result in the inability to generate an action potential in a nerve. So even though threshold potential is reached, there could be no rapid influx of those sodium ions, and therefore no rapid depolarization would occur of the nerve cell. So no active action potential would be able to occur. The last question then says, how does poisoning with tetrodotoxin explain Sabir's symptoms of numbness, weakness, and breathlessness? Well, since the generation of action potentials could not occur in Sabir's nerves because of this poison, then any signal would be inhibited in those neurons. And in the sensory neurons, that means that numbness would occur because sensory information would not be able to pass along on those sensory neurons. And any motor neurons going to the muscles would be blocked. The conduction of action potentials in those motor neurons would be blocked, and that would cause weakness and paralysis. So weakness and paralysis of respiratory muscles like the diaphragm and intercostals would be the cause of his breathlessness. All right, now let's look at the second one. We're talking here about inhibitory synapses and neurotransmitters. And we're talking about Cindy, a 46-year-old female. She had recently experienced several very upsetting events in her life. She'd been unable to sleep or relax since the events. Her doctor prescribed her a short course of Valium, otherwise known as diazepam, to help her relax and sleep. So Valium enhances the activity of the neurotransmitter GABA in the neurons, and especially neurons that deal with fear and anxiety. So GABA is an amino acid neurotransmitter, and it works at inhibitory synapses. So the first question asks, what is an inhibitory synapse? Well, an inhibitory synapse is one that inhibits the normal activity of the postsynaptic neuron. So this can occur if some of the channels are blocked. It can occur if the resting membrane potential is hyperpolarized and taken further away from threshold. But right now, we just want to know that an inhibitory synapse is one that inhibits the normal activity of a postsynaptic neuron. Meaning, so here we have the presynaptic neuron, and then here we have the postsynaptic neuron, and whatever is happening, this neuron is being inhibited, meaning that it's not able to reach threshold as easily as it is normal. So the next question is, where in the central nervous system is GABA, the main inhibitory neurotransmitter, found? So GABA is the main inhibitory neurotransmitter in the brain. And the next question is, which other inhibitory amino acid neurotransmitter is found in the central nervous system? That would be glycine. Glycine is an inhibitory amino acid neurotransmitter. It is found mostly in the spinal cord and the brain stem. Then we have, the next question is, what is the effect of a neurotransmitter such as GABA at an inhibitory synapse? So in your answer, you need to make reference to the flow of ions and the change of the cell membrane potential. So if we look at the postsynaptic cell, what GABA does, if GABA binds to receptors on the postsynaptic cell, GABA binds to and opens the gated channels in the membrane of the postsynaptic neuron that permit chloride and potassium across the neuron cell membrane. Now, potassium we know is higher inside the cell, and so when GABA opens up the potassium ions, the channels, potassium wants to leave, and that's going to make the inside of the cell more negative. And chloride we know is higher outside the cell, and so when chloride gates open up, chloride will come into the cell, bringing its negative charge with it. So overall, we are carrying out positive ions and carrying in negative ions. Now, normally we know that the resting membrane potential is negative 70 millivolts. However, if the more negative ions are coming in and positive ions are going out, this resting membrane potential is going to get more negative. So it might reach negative 80 or negative 90. And what this does is takes the charge, the transmembrane potential, that much farther away from threshold. We know that threshold is negative 60 millivolts. So instead of having to, at normal resting membrane potential, get increased or rise 10 millivolts, now because of GABA, we're looking at needing an increase of 30 millivolts just to make threshold to be able to create that action potential. So this is inhibitory. It's inhibiting because it's making the resting membrane potential more negative and taking it further away from resting. The next question asks what happens to the membrane potential of the postsynaptic neuron at an inhibitory synapse. Well, that answer is the postsynaptic cell membrane became hyperpolarized toward negative 90 millivolts. So hyperpolarization is anything below resting membrane potential. So resting membrane potential is negative 60 or negative 70, but the resting membrane potential was taken all the way down to negative 90, and that is called hyperpolarization. Okay, so that's what happened to the membrane potential. It became hyperpolarized. What effect does that have on the action potential generation? Well, it's going to make it unlikely that an action potential will be generated. At the very least, it's going to make it much more difficult because you now have to go 30 millivolts. You have to add, get a stimulus of 30 millivolts just to get it to threshold, and that is very unlikely. The next question is, given your answer to the above questions and the site of action of Valium, explain why Valium will help alleviate Cindy's symptoms. Well, Cindy is feeling a lot of fear and anxiety, and so there is a lot of action potential generation going on in those areas in her brain that help her to perceive fear and anxiety. And so if she's given Valium, and Valium enhances the action of GABA, that means that those neurons in her brain will have their resting membrane potential lowered to negative 90, making it unlikely that those action potentials will even be generated. And by not generating those action potentials in those areas of her brain, she will be able to relax. The last question then is, how could an action potential be generated in a postsynaptic neuron that's being inhibited? Well, the answer is you're going to need a much bigger stimulus. So you're going to need a large depolarizing current from some excitatory synapse that will open up sodium channels. So sodium can come into the cell and try to raise that resting membrane potential to threshold. And what I talked about was saying that you have to get that up 30 millivolts in order to get to that threshold. But if you have a large enough depolarizing current, meaning you have a stimulus that's large enough to open enough sodium channels, so you get enough sodium pouring into that cell, that means that the membrane potential could move up from this negative 90 all the way up to negative 60 millivolts, reach threshold, and then produce an action potential or generate an action potential. This ends our case studies for Chapter 12.